Senator?
Yep. Good afternoon, everyone. Pleased to see you all here today. I'm Senator Mary Washington, 43rd Legislative District, joined with my co-chair, Geraldine Valentino-Smith. We're formally beginning the joint
similar to what's being offered to businesses
and
that sustained flood damage due to coastal flooding in October.
Stop there, Mike, please. Thank you. Well, there's no good meeting without somebody, hearing someone's personal conversations. Again, I'll start again. I'm calling this meeting to order of the Joint Committee on Ending Homelessness for our Tuesday, November 9th meeting. We will hear from a number, every session, we have what we call advocate updates. Basically people who are on the ground doing the work, giving us an opportunity to find out what's going on. First, we're going to get updates on our efforts to address youth homelessness, which is one of the missions, specific missions of this joint committee. Then we will hear from healthcare, areas in healthcare. Also we'll get an update from the National Alliance to End Homelessness. And then the most important work that this committee has is to begin a discussion of our recommendations based on what we've learned the last year and what we've heard from our providers. Now I will pass the mic on to the good delegate from Prince George's.
Well, thank you, Senator. We're going to try to move through the agenda as quickly as we can. We're going to ask each of the speakers to limit themselves to 10 minutes, but we are going to have for DHCD a little bit more time. And again, with the Senator and I, we've been working on this for a couple of years, and it's a complex issue. And what we try to do with the recommendations is try to set forth some practical measures that we think can get accomplished either through regulatory change, through the work of the committee, and or through statutory change when needed. We recognize that our issue crosses jurisdiction with the standing committees, and at times we make just recommendations for the standing committees to spend some more time focusing on what we looked at during the interim. So we've accomplished a lot. We have a lot this afternoon on this complex issue, but we met earlier and we are excited to be able to put forth what we think will be some meaningful recommendations to leadership to start to make some change in this area.
So Delegate, I forgot to give our colleagues an opportunity to let the folks in the audience know who they are, because they do important work on this issue. So first, I'd like to recognize members of the Maryland Senate. To my left, I see Senator Arthur Ellis. I see Senator Sarah Elthworth, represents the great city of Annapolis. I see the good Senator Johnny Stalin. And I see my good colleague and fellow alumni of the Johns Hopkins University, Charles Sidnor. Good to see you all today. And these are your Senate members of the Joint Committee on Ending Homelessness.
Thank you, Senator. I think the senators are outflanking the delegates today. We have the good delegate Edith Patterson, has a real passion for this issue and has been on the committee a couple years. And the good delegate Mike McKay, who I serve with on appropriations, and has, again, a lot of sensitivity to this issue. I believe Delegate Mary Lehman will be joining us. And I know that there she is, Bartlett has joined us. She brings a lot of experience to this issue that we appreciate on the House side. And I think Delegate Learman may have had a conflict today, but certainly carries a lot of passion for this issue. So with that, should we start? Did I miss any delegates? Delegate Carol Krim is not here because she is chairing Joint Committee on Audits. And she was the leader on the Unaccompanied Youth Bill, and we'll be taking an update on that today, and we'll let the good delegate know. Okay, I don't think I missed any delegates.
Okay, well, so we'll start the important work. First, we'll get our update on efforts to address youth homelessness. This specifically will be looking at implementation of HB 206, our unaccompanied homeless youth minors, and the impact of COVID-19. First, we'll hear from the Phoenix Youth Project, Amber Green, who's the executive director and founder. And then we'll hear from HIS Hope Ministries, the Youth Advisory Board. So thank you. Ms. Green, it's all yours.
Hi, I do apologize for the background noise. Someone decided to do construction right now. So I do apologize. But I want to thank you all for allowing me to have the opportunity to share what Phoenix Youth Project is doing for our organization and for our area here on the rural Eastern Shore. One of the questions that I would like to bring to the group is, because I've been looking and I was wondering, is there any representatives from the Eastern Shore or the rural area that's part of the joint committee? Because if not, that kind of amplifies what we've been trying to say, that for a long time, the rural community has been left out of the conversation as a whole when we're talking about youth homelessness, just in regards to our area specifically.
There is a Senate, so there is representation. Senator Addie Eckert, she wasn't able to make it here, but she's on the committee.
She's in joint audits also with
Yeah. She's here. But to your point, I do believe you still have a point. I just wanted to interject.
Definitely, I appreciate that, because I think we were looking at the website to see when we work with the youth. We wanted to see who all was on the joint committee, and we didn't recognize some of our local names.
And we do have Delegate Edith Patterson, who represents a rural community, not the Eastern Shore, but Southern Maryland, that helps keep the rural perspective for the committee.
And Senator Arthur Ellis in Charles County, large rural community also.
And Delegate Mike McKay, do we call you rural?
Ms. Green, I think you can rewrite your first sentence. Let's continue on. But we get your.
I love it. I love it. That's what we do here. We just ask questions, and I love it.
Yeah. Well, let's just say it's definitely, a few years ago, it was not the case. And specifically, these members joined this committee this term to address the things that you've observed over your career. So.
Awesome. Well, thank you. To the next part of the slide, Phoenix Youth Project, we are an organization that just started doing service work working with homeless youth and young adults. We primarily was a creative arts organization, and we mainly focus on youth leadership. Our mission was to empower and encourage youth to use their creative talents to impact social change. And that has been an amazing effort in facilitating conversations, amplifying the work of youth and adult partnerships. And as we have grown, we have seen that, despite any of the youth's background or what they're going through, there's a leader in each of those who we're working with. To the next slide. So we've been empowering youth voices since 2013. We operate in Salisbury, Maryland. We envision a movement led by young people that ensures dignity to the youth, their families. Our programming is anchored in the belief that young people have lived knowledge and expertise to identify, prioritize, and direct the activities. Youth that we've been serving have become involved in our volunteer efforts, and we've also been able to actually hire youth with lived experience to be a part of our program development as well as our staff. Next slide. Youth are leading from the front. Creativity is the tool of our social change. That is primarily our tagline. Many of the Maryland Eastern Shore young people navigate daily lives with unfair level unpredictability. They need a connection to the community, to their history. And what we do is we develop their creative potential. We work with their critical learning and life skills, and we also have them work on their skills to be active contributors to their communities. And next slide. So our drop-in center, is in Salisbury, Maryland. It is the only drop-in center that works with youth, unaccompanied youth in the lower shore for 3 counties. So we work with Wacomico, Somerset, and Worcester County. We work with arts and media. So we have a studio in our drop-in center. We have a green screen. We have access to a lot of art teachers, artists, And then we also do adulting 101 courses, which are things such as how to budget for grocery shopping, how to fill out a W-2, how to open up a bank account, all those things that we haven't necessarily had the opportunity to learn in schools or different school settings. And so we try to have those courses here at our drop-in center, and they're led by some of our community members as well as community partners. And then what we also do at our drop-in center is we provide just basic needs. So we offer food, snacks, we operate a closet. We have a program called a drip box, where young people can go to our website and request a care package that's similar to like a college or dorm room care package, but they can also request an outfit. Maybe it's an outfit for a job interview, an outfit for work, or an outfit for, you know, just coats or anything that they need. So what we've learned in the year that we've been operating, since we opened up our drop-in center, we've actually serviced 84 unaccompanied youth. That includes minors and young adults, specifically just in Wacomico County. And out of the reported youth households in our 2021 Lower Shore PIT count, 73% of the age group 18 to 24 were Black. And 53% of the reported unaccompanied youth households with our PIT count were female. We aren't seeing a lot of unaccompanied youth already accessing our agencies. They are floating around. They are doubling up. They are couch surfing. And there aren't any spaces available for you to feel safe. Like I said, we are our only drop-in center out of the Lower Shore. And that being said, a lot of our shelters here aren't necessarily, not necessarily catering to the youth services, but some of their policies kind of discriminate against some of the youth. For example, a lot of our shelters are Christian based, and we have a lot of LGBT trans homeless youth. And some of their policies are not welcoming. In addition to that, we see that there are absolutely no youth shelters here on the Lower Shore. We're working with our COC to open up our first ever youth shelter in the next couple of weeks. So we're really excited for that. Next slide, please. And the barriers. Agency fatigue. That's a term that we came up with in our organization. Not sure if it's a real one, but we have a lot of clients and young adults who are just tired of going to agency. They have several case managers. They're going through the circle of, you know, trying to find a house, trying to find a shelter bed, trying to find hotel funding. And so a lot of our young people, by the time they get to us, we are working with them to try to build their trust, build up their trust in us, but also in their trust when we refer them to other agencies that can help them. And we advocate for them as well, because we also are aware that, you know, just with the time and the different issues in the different areas as far as equity and things like that, sometimes we need to kind of hold other agencies and other community partners accountable for how they're working with our young people. So some of the barriers that we have are shelter policies. Like I said, there's curfews for young people. For example, there's a curfew for one shelter that you have to be in by 6 p.m. If you're not there by 6 p.m., you will lose your bed. There's another shelter policy to where you have to report 80% of your income. They have to hold your income. If you don't let them hold your income, then you are risking being kicked out of the shelter. So there's different shelter policies that kind of create barriers in our local community. Then also the lack of affordable housing is a huge issue in our community. There is no affordable housing. Right now, 1 bedrooms in Salisbury are going for $1,900. I think that's the most expensive that I've seen in our area. And there aren't many affordable housing.
Wait a minute, I didn't hear you.
You know, I'm gonna sit here till you get a chance.
Okay, that's fine.
And also there is a lack of availability for low income housing. The wait list for housing is insane. In addition to lack of transportation, we don't really have a dependable transportation, public transportation in our area. We do have short transit, but that is a privately owned transportation system. And so unless it's Uber or Lyft, a lot of youth do not have access to, two cars or two vehicles. And a Lyft from, let's say, the Days Inn up north of Salisbury, which is about an 8-minute drive, would cost us about $15 to get them to our drop-in center. So it would cost $15 back and forth to get a young person from our hotel to our drop-in center. So those are some of the barriers that we have. And next slide. And some of the solutions that we have been doing in our area is we've been amplifying youth voices. We have a youth advisory board that meets every third Wednesday. They work to tackle issues such as things that we see in our community, as well as things that we're seeing in different agencies. We recently hosted our first ever youth-led town hall, which was led by the members and students of Salisbury University. And we had about 24 participants. And what we're doing is hoping to use information from those town halls to actually create a Bill of Rights for those experiencing homelessness and present that to our local city council and county council to join them and to have them join the conversation. We also do creative youth development programming. We have a digital media studio equipped with a green screen, recording tools, and we use that to not only just amplify the voices of the youth, but also to use those creative methods to talk about some of the issues that we're seeing. In addition, we advocate for change. We empower those who we serve, and we create leaders. We're always facilitating conversations. We allow youth to join us for these moments. We've had youth join us at the county council meeting, the city council meeting. We have members of our local elected officials come in and talk with the young people. We really just put them in the forefront of advocating for change. And those are just some of our solutions that we've had with our organization. And next slide. And that is it. It's so convenient. They stopped doing that when I'm done. But this is the address of our drop-in center. We create safe spaces grounded in social justice for young people to educate and transform lives. And I do appreciate, this opportunity to speak.
Thank you, Ms. Green. That's amazing. Colleagues, we'll hear the two other presentations and then we'll take questions. But I just want to say, that looks like amazing work. Could we now hear from the, I'm not sure who's presenting, but it's the Youth Advisory Board, HIS Hope Ministries.
Hi, my name is Desiree Jefferson. Sorry, I'm using Abigail's computer.
Okay.
I was like, let me send them an email real quick. I'm the program coordinator for the Midshore Youth Program. We are, go ahead. Introduce yourself, I'm sorry.
Hi, I'm Abby. I'm the intake specialist and I'm the co-chair in the Youth Advisory Board.
So we are primarily a shelter. We shelter men, women, family, and youth. We have a separate section in our shelter for youth on its own. And our program separately assists with not only housing, but also employment opportunities. So we refer out for job trainings and connections to local work skills trainings and other things like that. We also help connect with furthering their education. So if they need help applying for college and getting free tuition, we can help them with that. And we provide mentorship through outside programs, and within our program, we have peer support groups. We have connections to healthcare and stuff like that. And we also have advocacy opportunities through our YAB. And I think basically some of the things, trainings that we help with is exploring job interest and visiting places of employment, writing resumes, finding a job, educational support, GED, access to local resources, independent living skills, learning about finances, fitness and health, problem solving skills, decision-making skills, interpersonal skills, and recreational stuff, just for them to have fun. So some of the challenges that we've been facing right now, the number one challenge is affordable housing. During COVID, we've seen a significant increase in homeless youth emerging and a decrease in housing available. As soon as something comes available, it's taken immediately. So we're having a harder time getting them in and out of our shelter with ease. Landlords are less willing to rent to homeless youth due to stereotypical reasons. A lot of people think that homeless youth are homeless because they just aren't following the rules, and they're being rude and disrespectful and other things like that. But really, these youth mainly are put out of their houses because of discrimination against them from their parents. Also, the fear of lack of financial security, landlords aren't really able to evict. So when they get scared to rent to somebody who's homeless, because they get that fear of not being paid and not being able to get them out. Some landlords are requiring a vaccine upon entry of housing, and there is a lot of youth that aren't willing to get the vaccine right now until further tests are done on it and stuff like that. Some landlords are increasing the amount of rent to keep away from low-income families. I've had a few landlords specifically tell me that they were not willing to rent to any low-income families or anybody from the shelter at all. We have experienced a lack of funds due to increase in demand. Service providers are using all of their funds on all of the community, and they just run out. They tend to run out because it's just not enough. During COVID, it's been a really high increase on people needing funds. There are also unrealistic application requirements for COVID relief funds. A lot of these requirements, kind of like ERAP, the ERAP program and stuff like that, they require a lot of documentation that these homeless people just don't keep. They don't have enough room to keep their personal belongings. So they most definitely don't keep every receipt that they use. And sometimes they don't have bank accounts, so they don't have bank statements or anything to prove any type of income transactions and stuff like that. Most landlords are reluctant when it comes to assisting tenants' application process for rental assistance. A lot of applications right now for rental assistance relief require information from the landlord and a signature from the landlord. And I think the biggest issue is the landlords not really understanding why they play a part in it. So when they're being asked for their tax number and their social security number and their signature, they're like, wait, hold on. I need more information. And they're just not willing. And sometimes they just don't even want to deal with the rent, like rental assistance. They just want them out because it's easier with them out instead of dealing with all of that every single month. And the low income housing waiting lists are full. We have applications in every housing list for all clients, and there's almost a 3-year waiting list for all housing. So that has been a huge problem for us. Next slide. Can I do that?
Sure. I'm not as good at explaining what they are as you, so I'll read them. Our second challenge was receiving assistance. Actually, can you hear me that? Most employees are working from home, which makes reaching them more difficult. And I know personally, I have been put on hold multiple times trying to speak to somebody, but so many people are calling them at the same time. Usually the line just ends up going dead. Call centers and automated phone systems have been having complications, longer wait times for receiving responses and services. Most youth avoid services to lack on hands-on assistance with applications. Daycares will not accept new clients during COVID. Increased COVID-19 precautions taken by the school boards has resulted in parenting youth needing a second form of childcare. and youth have been struggling with access to internet for schoolwork, telehealth, and legal services.
So during COVID, we've been having a lot of problems with receiving services in different areas, not only from service provider sides, but also the youth. They're having trouble navigating the internet and phones because not all homeless youth have phones or internet. So when they used to be able to just walk in, get service, have somebody help them with the application, they aren't able to have any of these things. And we have to keep in mind that these youth typically don't have parents that teach them how to do these things. So the things that we're used to doing and seem like it's easy for us, it's extremely challenging for them sometimes because they never had that proper someone to actually teach them that stuff. Okay, so a third challenge is mental health. All of us have been living in survival mode during this COVID-19. Our fight, flight response has been triggered this whole time. And through that, it causes a lot of trauma and a lot of PTSD. The telehealth services provide a less effective solution. Youth kind of feel like they're being pushed off because there is a high need for mental health services right now during COVID. So they have been experiencing longer wait times, and some people just have even been stopping, they stopped taking patients. And youth, I already said that one, but basically we're seeing a high rise in mental health of people that didn't feel like they had a problem struggling with mental health before, they have now, and there aren't many resources for it during COVID-19. And the ones that are kind of booked up. So House Bill 206, I was actually excited about this one. We wanted to give you a huge thanks for this bill. It's a huge part of the puzzle to ending youth homelessness. However, I feel like us as a community have a little bit more work to do. We got to find room in the state's budget to invest funding towards more youth-specific shelters. These youth are having PTSD, they are scared of the stereotypical, oh, the shelter, it's a huge room full of a whole bunch of people with sleeping bags, and they're just scared. And some youth that are running away from abusers have PTSD from adults, like other adults in the shelter. So sleeping next to them probably isn't the best what's for them. They find that sleeping in cars, sleeping in abandoned houses, and sleeping on a friend's floor is more safer than going to the shelter. And I guess we got to work harder on having more youth-based services for that. Also, we got to work harder in informing youth about bills that have been passed in honor of them. A lot of youth, minor youth, don't understand that they are able to consent to shelter. And I feel like that's something that we can take on as a youth advisory board. We can take on that opportunity to push these bills out there to let them know that they do have this opportunity. And we have been doing that during the month of November. We actually have been going to each town and getting a proclamation for the month of November to be Homeless Youth Awareness Month. So we've been working on that and putting out information about all the bills that pertain to them. So that's something that we've been working on. And we must inform and encourage shelter providers about minors experiencing homelessness. A problem that we also are experiencing are the shelters that are available to minors. They are kind of like put offish when it comes to it because they aren't really understanding where they lie when it comes to being responsible for them. And that is also something that we've been taking on as a youth advisory board to try to promote to them that it is okay. And within the bill, you aren't responsible fully for these minors and that you should be welcoming them into your shelter. So as a team, we can all work together collectively to end youth homelessness.
Thank you. Thank you so much. Your recommendations, your insight, as always, it's important to hear from people who are very closely related to folks who are most experiencing this issue. Just Stuart, if you don't mind, I did, and please, I just wanted to ask a question around you said that minors that minors were that they weren't aware that they had this right, and that also some providers are still reluctant. Could you just say a little bit more about that?
Okay, so most minors are, well, so when we go out into the community, we talk to minors, they say that they avoid shelter because they're scared of the foster care system. There are a lot of gaps within these things, and they think that if they were to go to a shelter, they would automatically be put into that category. And that's the fear that they've been having. Okay. Also with service providers, I know you have to, I guess, register online to be a youth provider, right? Mm-hmm. For the bill. Mm-hmm. These people are kind of scared. These providers are kind of scared because they don't know the logistics of the bill. So I think that's more of a just informing them more into it, so that they can better understand and be willing.
Absolutely. Thank you for those insights. We look forward to working with you on this. Mr. Campbell, so this is a great transition to your update on the implementation. And hopefully, I think you heard some of their, I think, right on observations about the opportunities and the limitations. So,
sure. Well, good afternoon, senators and delegates. Always a pleasure to see you and present to you. If we can go to the next slide, this really is a short presentation because there's aren't a ton of updates, but I did want to provide a little bit of background for those who perhaps weren't involved. I know that, of course, the members of the Joint Committee were very involved in the crafting of HB 206, but some others who are listening today may not be. So I did want to just walk through a little bit. HB 206 was enacted as part of a recommendation from the work group to study shelter and supportive services for unaccompanied homeless minors. This was a work group that met in 2019, calendar year 2019. A number of folks, advocates, members, departments were on the work group, and the legislation HB 206 emerged from that. What this bill primarily did was authorized unaccompanied minors who were in need of shelter to consent to the shelter and supportive services. There were a few attachments, regulations attached to that. One is that it requires parental contact within 72 hours. However, if the provider suspected abuse or neglect, those suspicions must be reported to relevant authorities. And it provides protections against liabilities for the service providers. And I think that was an important ask or request from a lot of service providers who were concerned about the liability challenges that came with serving unaccompanied minor youth. And so this, as long as a service provider followed the letter of the law and the regulations, then they were protected against liability. If we go to the next slide, the other thing that was added that really impacts my agency is the registry that was referenced earlier. Effective July 1st of 2020, any public or private nonprofit organization that provided shelter or supportive services to minors in need of such must register with the DHCD. If we go to the next slide, I think this is hard to see, but this is what the form looks like. We do request information, the contact information, provider's name, address, point of contact, but more importantly, there are 3 specific attestations that the provider must agree to. One is that the organization will be in full compliance with the statute, which is now Section 4207 or 701 of the Housing Community Development Act. So basically the unaccompanied minors in need of shelter. Also, they must hereby agree to develop and implement a procedure to screen each staff member. And this is the background check that is required from the bill. So each organization who registers must say that, yes, they are in compliance with this requirement, and then that the provider hereby further commits to provide appropriate training for staff. I think this was an important piece that the work group felt was necessary in working with minor youth. If we go to the next slide, these are currently the registrants. Yesterday we had 10, and now we have 12 because we had a couple additions, late additions. But these are the organizations that are currently registered. This actually makes sense. We never expected it to be a long list. And in fact, this is probably a little bit longer than we might have suspected because of just simply the size of the state and the number of shelters and providers out there. But I also think there may be a few on here who are just preemptively registering in the event that a unaccompanied minor youth comes in their doors, and they just want to be prepared and fully in compliance. Now, I will say that DHCD very specifically stated when I was on the work group that we don't have capacity. We are not a regulatory agency. We do not have capacity to ensure enforcement, but we do provide funding to nonprofits and local governments all across the state. We work very closely with the local continuums of care. And so we are looking for compliance with federal and state regulations and rules based on our funding. But a lot of any additional work that we would be interested in doing related to this bill, unfortunately, was consumed by the department's response to COVID. So there has not been a lot of activity beyond the establishment of the registry as is required by state statute. So I think that really is the end of my slides. It was a pretty short slide deck because of the material that we are responsible for, but I'm happy to address any additional questions.
Thank you. Thank you so much. And it was really helpful to remind people about what this was and that it has provided these opportunities. Could you just speak to the observation, the extent to which you can, around youth not being able to access, or just kind of working through that, individuals not being in the office and youth being accustomed to dropping in terms around COVID? Sure. Any thoughts about how to and also, frankly, their critique around telehealth, which I think was a very interesting one. I'd like to hear more about later. And then we'll hear from Delegate Lehman.
Sure. Unfortunately, I can't speak to telehealth. That is absolutely outside of our realm of experience. And so, but I completely understand why that would potentially be a barrier. In terms of access, I think things are slowly returning back to the way it was. People are now working more in the offices. We were, I think I reported in the last time that when the pandemic hit, we immediately began weekly calls with the COCs talking about decompressing shelters, creating space, putting people into hotels and motels. It was literally what we needed to do to reduce any chance of sharing COVID. I think one of the reasons why we did not see a huge flare up in the homeless population is because of that quick response. But it also, we recognize, creates a barrier for those who don't have access to the internet, or maybe don't have a phone, who don't have the ability to respond to an application online. So I do know that there were a number of shelters that did continue to have folks in the office space or the shelter space. I think that's going to continue and grow over time as people become more comfortable getting back. So I'm hopeful that that will be less and less of an issue. We do recognize that there are some shelters who are higher barrier shelters. In fact, we had a training yesterday for all of the shelters across the state for low barrier, how to become a low barrier shelter, how to utilize trauma-informed care, housing first, all of that. So it is an issue that we continue to work on. Some of these shelters we have, affiliation with because we fund them, others we don't. And so we have a harder time encouraging them to adopt what we think are best practices.
Absolutely. Thank you. Thank you. Thank you, sir. So I didn't see my co-chairs. So Valentino Smith and then Lehman.
Thank you, Madam Chair. Why don't we'll go ahead with the committee members and then I'll do.
Okay, great.
And then why don't we have Mr. Campbell hold on the emergency rental assistance till after we finish this round of questions.
Sounds good.
So Delegate Lehman.
Thank you so much. And I don't know if this is the right time to ask this question, but because I jotted down a comment about DHCD, and I wanted to ask if it was okay for a little bit, I guess, of a further explanation of the comment that DHCD is not a regulatory agency, and that it partners with nonprofits and local government, but it doesn't have any, I don't know if the word was enforcement or compliance sort of powers or capabilities. And I wonder, I guess this might explain in part the concern that I've had, and I've heard from some colleagues and from constituents that local DHCDs seem to be, and I don't want to stereotype, some are probably maybe more adept at others than getting out this, the federal monies to avoid eviction. But it seems like what you're describing, the way you're describing state DHCD is true of a lot of counties. It's definitely true in Prince George's. I mean, they do the best they can, but they also, were not prepared. And I'm saying this as a former county council member. This was my observation long before COVID and the eviction crisis and all of this relief funding. But, I guess this is a question/concern that, why would state DHCD give all this responsibility to the locals to get this money out, when it seems like at least some of them, if not a lot of them, are in the same boat where they're not used to running programs directly and don't have sort of the staffing or the training to do enforcement/compliance. Why would we think that would work? And it seems like there are a lot of challenges. And if this is the case, then it makes sense. It doesn't make it okay, but it makes sense that there are all these challenges in getting this money into renters' hands. It's really problematic.
Okay, if we could hold on that, and then I just want to see if Senator Ellis's question is around the youth homelessness minors questions first, and then we'll get back to that. We absolutely agree.
Sure. Okay, thank you.
Senator Ellis.
Yeah, thank you, Senator Washington and Chair Valentino Smith. I appreciate you recognizing me in this hearing, and all the presenters. I have a comment and then a question. So I know when Ms. Green was speaking about House Bill C-206, this is a big bill, so I'm trying to get my mind around it. And being a new senator, it's tough enough to keep track of stuff happening in the Senate, also in the House. So I'm doing my research here. And so House Bill 206 was also crossed by with Senate Bill 207, which was sponsored by Senator Washington. And so there are companion bills. So we were active with getting this through also on the Senate side. And so that just kind of brought my memory back. And so we have House Bill 206/Senate Bill 207, which are cross-file, which does the same thing. And so, and also with the year, I was like, okay, what year was that? I'm only there 3 years, but I'm getting to be an old guy, right? So I'm here searching, looking, and so pretty much took up some brain power from paying attention to Mr. Campbell as he gave some of his presentation. So pretty much I have a question, Mr. Campbell. So of all those groups servicing youth, my question is, are any of them in Charles County? Because I know in Charles County, which District 28, which I serve, represent, we have a serious youth homelessness problem. before the pandemic, the year right before the pandemic, the school system gave me a number like 824 homeless youth. I know of some who are unaccompanied. And so my question is, any of those named on your chart, are they located in Charles County? Have you done any work with any Charles County shelters with youth?
So no, the answer is no. None of the shelters or organizations that have registered are located in Charles County. I'm looking at a list right now, just to see if any of them cover Charles County, but according to the information that we have, which is self-reported, we do ask them what counties they cover. None of them serves Charles County. That doesn't mean that there are not shelters that serve youth in Charles County. This is specifically for minor youth under the age of 18 who are unaccompanied.
Right. Okay.
So
yeah, understood. So basically, I'm thinking about your position, and none of those were on the list, and I know of none really. Just a couple of weeks ago, the delegation, myself, were at the opening of the first comprehensive homeless shelter in Charles County, which the Senate and the House were instrumental in funding, over half the funding for that shelter. And so this is something that I know we need to look at, because we definitely have that problem here in Charles County, and maybe we extend it to the Southern Maryland region. Okay, thank you, Madam Chair.
Great. Okay, all right, so pass on to you, Delegate, and then transition after your question.
Thank you. And then I do want to keep us mindful of the time, because we have starting at 3. So for the two presenters from Phoenix and His Hope Ministries, just briefly, if you can help us understand the population of unaccompanied youth as they come in. Are the unaccompanied youth that come in, are they carrying with them or availing themselves of any SNAP benefits, or do you see them using the SNAP benefits? Do you see them having any access to Medicaid or the Medicaid managed care cards, or access that they should have for primary and mental health and or substance abuse care? And then especially, near Salisbury, we passed a bill where we're asking the colleges, both community and higher ed, to have point-specific persons to help them with entry, and then tuition-free education if they're qualifying as homeless. So can you give us a sense on, are the youth, you indicated they're having difficulty trusting the system, they're having difficulty filling out applications, they're having difficulty really probably understanding what is or isn't provided to them, and they have agency fatigue and resistance to enter foster care and or probably the Department of Human Services. So are they really just riding there with nothing that they're eligible for? Or are you seeing them using some of the services that they're eligible for?
I can say about, oh, sorry, you want to go first, Amber?
You can go ahead.
Sorry. I can say that about like 80% of the people that come our way come here with no services. I can't say why. They have access. There's a lot of services here, but they just don't have it. Food stamps, Medicaid, they just don't. And when we go to get it, a lot of times it's a very long waiting process, and that steers them away from even trying. When you apply and get denied and apply and get denied, and they just try, and their mindset is, I've been doing it on my own for this long, I'm just going to be resourceful and figure it out. So we have to kind of look into where the problem lies. Easy access maybe to you. Sorry.
No, go ahead. I'm sorry, I didn't hear.
Maybe easier access for them, and a little bit more of a hands-on access. If there were people that were youth-based providers that could help youth further in hands-on application help and hands-on like explaining the whole process. Like for food stamps instance, it's a 60-day process. You turn in this, and that. This is what will get you denied. This is what will get you accepted. And this is what you need to provide. That would be more easier for youth. Because again, we have to remember that these youth don't have parents. They aren't taught these things, and they actually need somebody to explain and help them. And then further on in life, they'll be able to navigate better because they at least had that one adult to explain it to them.
Do you sense that the local service department, the local family services department, then doesn't have either the social workers or the resources to send over to you, or for if you send a youth there, for them to get a timely response?
I can't say that they do or don't. However, I don't believe they have somebody specifically for youth to help them with the application.
Oh, Ms. Green?
I would also add that in addition to the capacity or resources, most of the staff of some of our agencies locally just aren't equipped to handle youth or young adults. We also have to realize that some of the young people that we are working with, they have criminal backgrounds. They have been in contact with the judicial system since the age of 8 or 12 years old. So they have a problem with authority. We also have a lot of young adults who are constantly losing their important documents. These are important documents that are needed to get food stamps, like Social Security cards, birth certificates, rental history, things that they don't have. And there's only one agency here locally that is able to help them get those resources for no cost. If they don't go to that agency, they have to pay out of pocket to get the new copy of their Social Security card. They have to pay out of pocket to get the copy of their birth certificate. In addition to some of those barriers, we just have a lot of lack of grace, I think, extended to the youth community. And what I say that is, for example, prior to opening up the drop-in center, we've had young adults who they've missed their recertification with DSS to get food stamps because they missed a phone call where their phone was disconnected, or the address that they had listed on file, they've moved from place to place and they haven't been able to update. A lot of people who do have food stamps, they don't have the online access account. They don't know how to log in on their phone, or they lost the password, and resetting that password is it's time consuming, or they don't have an address to get their mail. And so at our drop-in center, we allow them to use the address for their file so they can get mail here. And also for those who want a little bit hands-on approach, which the group at His Hope Ministries have said, they definitely need more hands-on work, working through the application. And so there are some of our young people who would say, hey, Ms. Am, can you be the authorized person? Can you talk to them? I don't know how to, as simple as I don't know how to talk to them. They ain't listening to me, Ms. Am. So there really is a hands-on approach. And with the agencies in the Salisbury area, there aren't individuals who are specifically geared to work with youth and who understand the trauma that they're going through or their lived experience, and who have that patience. We have a lot of young people, especially young adults, who get kicked out of programs because they are not following the rules of the programs, or they're not making appointments and things like that. That's also because of the lack of transportation, the lack of access to phones and different things like that. But what we're seeing is the lack of important documents keeps young people, especially young adults, for being able to get resources like food stamps.
You're talking about the post they're out of high school, because I know that schools have a designated homelessness counselor for them. Well, thank
you. And also with minors, we have families who have not received their EBT cards, who is getting the runaround from the school board, not being able to get their cards actually in the mail. We also have a lot of, in our cases, where someone has been, have stolen their food stamps. So there's a lot of things that kind of come into play with a lot of our minors, especially if they're not in the home of their parent, but they may be in the home of their aunt or their uncle, and my mom won't give me the food stamp, or my dad, he took the food stamps and the cards and he's over in Baltimore, and so we can't get the money. So each case is different.
Well, thank you both for helping to give us, an on-the-ground perspective of what these youth are facing. And for the committee members and Madam Chair, you'll see in our recommendations, I think for the last couple of years, what we've consistently heard from the advocates, and again today, is that there's a need for specific case management.
Absolutely.
You have case management of a high-risk population. you have a higher success rate back to them getting the benefits that they need and maintaining a consistent level of services. And so you'll see that in our recommendations again, but you have brought home for us that there's a lot that they're entitled to that they're not accessing simply because we don't have a consistent case management system for these high-risk youth. So thank you.
Do you mind if Senator, if this is a burning desire, would like Senator Saling to briefly make a comment because we want to transition on to the next topic.
Yeah, that'd be very brief. Thank you very much.
No problem.
I've heard, and if anyone could answer it, this would be fine. That, and I've been to some of our schools, and I've had principals and teachers tell me about the homeless students that are in their schools, and I know that's a problem. And I know we're trying to do all that we can, and I know hearing about waiting lists, which I know is concerning. Is there something else more? And I know financing is always the biggest issue that we need to help more finance and finding other areas that we could throughout our state to get services, but also to have placement. Is there anything else that we need to do to maybe make a difference in these young people's lives?
And please, both panelists, please feel free to answer. The good senator represents an underserved community, not unlike many in Baltimore City, but he's located in Baltimore County.
In the Dunlop area and other areas. But thank you, Senator.
I would say right now in Wacomico County, each school has a pupil support worker that works with the unaccompanied and the homeless youth population. But within the whole county, there's only one homeless youth liaison, and then they have the case manager, and they are overwhelmed. Wacomico County served 467 families in transition. And with that, I think if we had more support to the schools that specifically work with that target group, that would actually help us collect data as far as targeting and counting unaccompanied youth in general in our area. Like I said, our PIT count was able to collect data, but it only counts 19 homeless youth within our COC. That is absolutely not correct. Our drop-in center served 84 alone in our first year of operation. So we had more youth specific or, caseworkers or case managers that were specifically working with youth. We can identify more, and we can also get resources to them quicker.
Yeah, I say that real quick, if you don't mind, because I know that when I talked to them, I think they were kind of lost because they didn't have anybody to talk with or communicate with. So that's the only reason why I asked, but I thank you. Thank you very much.
Thank you very much. Okay, now I'm sure Ms. Smith would say me too, which is what we do. And so we'll continue on. We'll give you an opportunity later. Go ahead, Senator. We do have to go to the next panel. Sorry, again, this won't be the last time we get an opportunity to talk with all of you. Believe us. Thank you. Go ahead.
So Senator Washington, do we want to let Stuart do the emergency rental assistance part now or continue with the advocates and have him do that at the end? You're on mute. You're on mute, Senator Washington.
Let's do that now because we know we have some burning questions, but right. Let's keep it to 10 minutes or something like that, 15. Let's keep it to the 15.
So why don't we have staff, I think we'll have staff, Emily, do a brief introduction to it, and then HCD can respond, knowing that when you do respond, we're hearing a disconnect in the community with respect to the availability of the emergency funds and if they are at risk or not of being retracted back by the government. Okay, Emily, go ahead.
Thank you. My name is Emily Haskell, and I'm a budget analyst with the Department of Legislative Services. I'll give a very brief update on where the state is with the first round of emergency rental assistance program funding. The U.S. Treasury established a threshold for program expenditures of 30% by the end of September to avoid potential recapture of funds. As you can see in the chart, DHCD, that's the top line, the state allocated funds, fell slightly short at 26%, while all 8 local jurisdictions in Maryland that received direct funding exceeded the threshold. However, Treasury offers some flexibilities that DHCD can still use to avoid the recapture of funds. The options include 1, certifying to Treasury that they have since passed the 30% mark, and 2, certifying that they have obligated more than 65% of the funding, and that's obligations as opposed to expenditures. DHCD has done both. It's also important to note that the initial funding allocations from Treasury were based on population rather than the number of at-risk renters in each jurisdiction. So DHCD elected to distribute the state allocated funds to the local jurisdictions in a way that corrects that imbalance, which you can see in the chart on the screen now. DHCD also encouraged the largest jurisdictions to prioritize the spending of the direct allocations first. And that's all I have. I'll turn it over to Stuart to provide more context and answer any questions.
Thank you, Emily. And I'm happy to share and hopefully clear up some misconceptions, because there are a lot of them out there. And I think in large part that's due to the fact that the Treasury has been releasing changing guidelines and guideposts and moving targets over the last several months. In fact, quarterly reporting was due a couple weeks ago, and at 10:30 the night before, they sent updated requirements for quarterly reporting. So this is what we're dealing with, and I can completely understand why there's a lot of misinformation. So let me just start with repeating and maybe rephrasing some of the things that Emily has updated, because I think they bear repeating. Treasury has released new guidelines on expenditure targets. And one is that being states must have expended at least 30% of funds by September 30th. And then almost immediately they said, however, if you have not, then you can certify to us that you have expended them by November 15th. We know, even though we only have preliminary numbers, but we know as of October 30th, we have exceeded the 30% of funds by November 15th. I mean, we exceeded them 2 weeks ago. So we will meet the 30% expenditure rate, and we are on track to meet the future targets of 40% on November 30th and 50% on December 31st, and et cetera. So I just want to underscore and be abundantly clear, no jurisdiction in Maryland is at risk of having funds recaptured. We are not at risk of having funds recaptured. So we also, as Emily mentioned, have met the obligation requirement. What the obligation requirement means that 65% of funds must be obligated, and they have included subgrantees. So our contracts with the local counties in the city of Baltimore mean that we have obligated over 85% of our funds, again, meeting the statutory requirement that the Treasury has outlined. Emily also mentioned the fact that 82% of renters live in the 8 jurisdictions that received direct allocations. However, those 8 jurisdictions only received 36% of the funding from the direct allocation out of the total, which didn't make a lot of sense. And we always like to point out that Baltimore City and Anne Arundel County received essentially the same amount in a direct allocation. However, they have starkly different renter populations. So what we did is we looked at that and we utilized our funding, the $258 million that we received, to balance things out a little bit. We implemented a lot of different factors in our calculations and our formulas, and took into consideration, a big part of it was taking into consideration the number of renters and those who are at risk of eviction. So when we did that, it really evened things out. But it also meant that the direct counties received a lot more of our funds, but they also had their own spending deadlines to meet. So we encouraged them to spend their funds first, because we have the ability to move state funds around within the state. They do not have the ability to move direct funds around with other local jurisdictions. So we wanted to make sure that none of their funds were recaptured. If that makes sense, hopefully that makes sense, because that was by design. And it was, as the state agency, we are looking at a state perspective. And so we wanted to ensure that none of the dollars that the locals received would be recaptured by the Treasury. We wanted to make sure that those funds stayed. And so we worked with them to encourage that they spend their funds first. So I think there was a question earlier about our ability and the local DHCDs or local housing departments or the agencies that receive the funds. As I mentioned, and as Emily's chart showed, all of the direct allocation jurisdictions have met or exceeded the threshold, so they're not at risk. There are some local jurisdictions who are spending a little bit more slowly, but there are some local jurisdictions who need more money already. So it kind of depends on the structure that each local set up. We are continuing to be in constant touch with them. We provide training and technical assistance. And so we are helping them improve their programs all the time. I did want to have one final comment that I'll, and then be happy to take questions that in reference to a comment that was made about youth not being able to get ERAP funds. Program regulations were also updated in September, making it much easier to accept self-attestation. However, it's possible that that may still be rolling out a little bit and not all jurisdictions are aware. We do know that Caroline County, though, was very excited and very receptive to utilize self-attestation for tenants. So I would encourage the youth who maybe weren't able to receive funding assistance before to reapply. However, the one thing we don't have control over, which is a federal requirement, is that all of the landlord requirements that are in place are mandated by the Treasury. In fact, all of the requirements that are in place are mandated. We have put 0 additional barriers in place to hopefully make sure that these funds are as available to as many people as possible.
Thank you. Did that answer your question, Delegate Lehman?
Yes, it did for the most part, but if I could ask a quick follow-up. One of the things I was concerned about, I talked to a colleague about, I had also heard it prior by word of mouth, that in some, if not all jurisdictions, that renters are being told they cannot apply for assistance unless they're already late on their rent. And if that's the case, is that the case? And or do you give the counties discretion whether they can, apply a day in advance knowing they're going to be late, or whether they have to wait until a day later? Because of course, until October of this year, until October 1st, when a new law took effect, landlords were able to go file for eviction at the very same time their renter was even 1 day late. So that's cause for concern. Can you explain that, whether that's a discretionary decision by counties?
It is a discretionary decision by county, but we know that the vast majority of counties do provide or do offer prospective only rent. In fact, all of them provide arrearage, support for arrearages, but the majority of them, the vast majority of them, also allow for someone to come in and apply for prospective assistance. So if they know they're going to be late, they can apply. So I would need to know exactly what county or what service provider you're speaking of, but it is not the case that that's prohibited.
If a county, and this is only through word of mouth, I can talk to you offline. If a county is saying, no, you actually have to be late, is that incorrect, or are they allowed to tell renters that?
So the 8 jurisdictions, this is where it gets a little more complicated. The 8 jurisdictions that receive direct funding may use their own funds and have discretion on whether or not to do prospective only assistance. If they receive state funds, all of them that receive state funds using our funds must provide prospective only money as well. So it's likely that you're speaking about one of the big 8 jurisdictions, and they're utilizing their own internal funds, their own direct allocation, which we have very limited control over.
Are there any, okay, that's helpful, but are there any jurisdictions that are mixing the funds, or is that allowed to combine federal with their county funds, and then it becomes a gray area, or is that not happening?
So there are jurisdictions who have local funds that they're putting into rental assistance. And in fact, one of the things that frustrates me is that DHCD was providing rental assistance of the tune of about 113 million all in 2020. So there was a lot of money out there already, even before ERAP. But the fact that some of them may utilize county money or local money, they would still need to adhere to the federal regulations related to ERAP. So if there's $1 of federal money in the check they're writing, then they have to adhere to the federal regulations. And again, the big 8 that have their own money directly from the feds, as opposed to us, which is a pass-through, they have the ability to decide whether or not they want to spend their direct funds on prospective only. But when they use our money, the federal money that we administer, then they must allow for prospective assistance.
Okay. All right. That's helpful. Thank you for that clarification.
Sure.
And I'll follow up with you offline with 1 or 2 other concerns about
Absolutely.
2 jurisdictions in particular.
Okay.
Thank you.
Sure.
So we only have about 45 minutes left today with some more presenters and recommendations, but Senator Benson, do you want to ask a quick question and we'll move on? You have to unmute, Senator Benson.
Thank you very much. Thank you, Delegate. Listen, thank you for your presentation, Mr. Campbell. Thank you also very much. But here's the question I want to ask. For Prince George's County, how can we, those of us who are from Prince George's County, have access to how the money is being allocated? Do we talk to the people on the county level, or do you all have that information available?
So we award to the county, and in Prince George's, it's the Prince George's Department of Housing and Community Development.
Right.
They decide on the sub-grantees. So if they want to work with nonprofits around the county, and I will say 90% of the counties do this. If they want to work with a nonprofit, then it's their discretion. Now that nonprofit must follow the rules if they're using our money again, but they decide on the county level, county government level, which nonprofits to use, which, providers. So if you had some thoughts on how you would like to see them allocate funds to other service providers, then you would talk with individuals at the Prince George's Department of Housing and Community Development.
Well, I don't want to pursue it because we do have other presentations, but I'm just very concerned about, this is one of the biggest problems that we are facing as elected officials of the disbursement of the money for the homeless, of helping these people. It just seems to be something is missing, but we'll talk among ourselves about that.
Thank you, Senator. And
Valentino Smith, I think we need to talk about that a little bit.
No, I think we're from the same county, and thank you, Senator. I will get with you later this week, and we'll work on getting some more details together. So with respect to that, we're going to move on. We have healthcare for the homeless. Liz Goldberg, we're going to ask you to try to present within 10 or less minutes if you can, Liz.
Yep, let me set my stopwatch here.
Okay.
And Liz, we
I-
don't have any slides. You're just speaking from the heart today, or?
Yeah, sorry, I
Okay.
ended up getting sick last week and didn't get around to making slides.
Okay.
So I was given a pretty broad topic, mental health and homelessness, and how the pandemic has affected our practice. So I thought I'd just go over some facts or trends in the topic of mental health and homelessness that you might not be aware of, and then talk about how the pandemic has affected our practice. So there's a myth that everybody who's homeless is mentally ill. And in fact, the numbers are really actually hard to pin down exactly, but the rough estimate is that somewhere between 25 and 50% of people who are homeless do live with a serious mental illness, which would be something like schizophrenia, bipolar disorder, PTSD, something beyond just regular depression or anxiety. And part of the reason that so many people who are homeless are dealing with mental health issues is their history of trauma.
Hey,
I would
Doris.
say, sorry. Oh. Okay. The vast majority of our clients at Healthcare for the Homeless have a history of trauma beginning in childhood, whether it was exposure to substances in utero or childhood abuse, whether that's physical, verbal, sexual abuse. They are the vast majority of our patients that have struggled with these issues. One thing that shocked me since I came to Healthcare for the Homeless was the percentage of male patients who were sexually abused as children. I'd say it's 80% or higher. So these histories of trauma before they come to us really it's something that they have to struggle with, and especially if you went through trauma as a child, it can affect the architecture in your brain, the ability for you to cope with stressors in the future, the ability for you to get along with other people. That can all be affected by childhood trauma. And then there's also trauma that they might have experienced as adults. For example, I'd say at least half of the female patients that we see have been the victims of domestic violence, intimate partner violence. And an awful lot of our patients have been assaulted or mugged, sometimes at gunpoint, and those experiences are also traumatic. And the veterans, we see a good number of veterans, and they actually have a higher rate of PTSD than non-veterans, whether they've served in combat or maybe they experienced hazing or some other traumatic issues while they were serving. So that's another way that they might have experienced trauma as adults. And then homelessness itself is traumatic. The homeless are actually, even though there's a myth that they can be dangerous, they're actually more likely to be in danger than to be dangerous. They're often seen as easy targets by people who are looking to prey on somebody. I'd say almost all of my patients have been mugged at least once. I'd say the vast majority have been assaulted in one way or another, whether it was during a mugging or not. Quite a few, I'm not sure the percentage, but a lot of our female homeless patients have been raped as adults. And I actually have two separate clients who were set on fire. These were at different times and places, but each one was just sleeping in a tent and somebody thought it was a prank or something to set their tent on fire, which that's also very traumatic. And they ended up having to spend months in the hospital and then deal with PTSD afterwards. Okay, so another topic you might not know about with the homeless is that there are a couple of special populations. For example, people with intellectual disabilities. I don't have an exact percentage, but I'd say probably maybe about, if I had to guess, about 10% of my clients have an intellectual disability. And they don't tend to have the distinguishing features of Down syndrome. So you wouldn't know that they have a disability until you actually spent time talking with them. But the story tends to go that the client was living with a parent who took care of them, or with a spouse who was basically taking care of them. And then the parent or spouse passed away, and then the person became homeless because they're just really not able to take care of themselves. I have one client, for example, whose wife passed away, and then he became street homeless for about 10 years, finally got into a senior apartment, but he has no idea how to work a stove or an air conditioner. He doesn't know how to pay bills or balance a checkbook. So we have an occupational therapist working with him, trying to help him with these things, but it's not always necessarily safe for them to live alone. And then another special population among the homeless would be people with dementia. And given that the number of homeless elderly is growing, the number of homeless dealing with dementia is also growing. And it can be very difficult for these individuals to take care of themselves and to be able to do the things that you need to do on a daily basis to get by. And these two populations, the people with intellectual disabilities and dementia, they also tend to be targets. Even if they do stay at like a shelter, they tend to have stories about the other residents at the shelter taking advantage of them, stealing from them, getting them to do things that they don't really want to be doing. So those are some special populations. And then as far as substance abuse goes, there's another myth that everybody who's homeless is addicted to a substance. It is fairly common among the population, but not everybody thinks about the reasons why they might be using substances. One might be it's a form of escape from the marginalization and isolation and humiliation that they live with every day being homeless. Another reason they might use substances would be to self-medicate mental health symptoms, like, for example, anxiety, depression, psychoses, PTSD symptoms. And then third, another reason they might be using substances is to fit in, essentially, because if you're homeless, the vast majority of the other people in the environment that you have access to, the social networks available to you, are using substances. So you might just do it to fit in, essentially. And then finally, how the pandemic has affected our practice at healthcare for the homeless. So overall, there have been pros and cons. Once everything basically shut down, we started doing all of our appointments by telephone, because while the majority of our patients do have telephones, very, very few of them have phones with video capability. So we weren't able to do this sort of, Zoom call or anything with them. So you have to just go with the audio. And one of the pros of that is that our no-show rate dropped dramatically. Prior to the pandemic, our no-show rate was always around 30%, just because for this population, it can be very difficult to get from one place to another to get to the clinic. Maybe you don't have the money to catch the bus or to take an Uber, or maybe you don't have a friend who can give you a ride. And it can also sometimes be hard to get to places on time. And with the delivering services by phone only, we took away that barrier. They just had to answer the phone. So our no-show rate went down quite a bit. But then the con is that you lose that visual component. When you're doing a psychiatric assessment, part of that is what they call the mental status exam, and you're looking at how the patient is dressed, whether they're making eye contact, are they hyperactive or hypoactive. If they're taking antipsychotics, you need to watch for any extra movements that might be a side effect of the antipsychotic, like tardive dyskinesia, or what we call extrapyramidal symptoms, abnormal movements. And we can't do that without the visual portion of the visit. And then another con would be that it's harder to build trust, I think, when you can't see each other. And because so many of our patients do have a history of trauma, it can be very difficult for them to trust somebody that they're just meeting for the first time, or even that they're meeting for the 10th or 20th time. And if you do have the visual component, if they can see you with their eyes, whether you're making eye contact with them, what's your facial expression, what's your body language, those things can help to build the trust, but when you don't have them and you're just a voice on the end of the phone, that can be difficult. And I know some of the earlier presenters said that some of the youth clients that they work with felt like they were being somehow marginalized by having only audio mental health visits. And we can totally understand that's the perception. But during the pandemic, when we couldn't have people coming into the office right away, it was really the only way we could do visits at that point. Now we're doing a hybrid. Some of our visits are by phone still, and some are in the office. Most of our staff are vaccinated now, and we're trying to get our population vaccinated. The number's still somewhat low because there's some resistance there, some misinformation. But anyway, we do wear masks and everybody's using hand gel and whatnot. So we tend to ask the clients, what do you want to do? Do you want to come in for an appointment, or do you want to do it by phone, and let them decide? Because different people have different preferences. And that's it. That's all. I'm happy to answer any questions if anybody has any, or if you want to do that later.
Well, no, thank you, Liz. I'm having a Senator. Oh, there we are. I was going to ask you to take over because I lost the Zoom. Thank you. You've provided us with a real face and the details to the population that we're trying to serve, and we appreciate that. And you did it.
You're welcome.
At a time. If I don't see any questions, so before we move on to the next panel, just briefly, when you're treating most of these patients, do they have access to Medicaid, and do they have their Medicaid information?
The majority do, yeah. There seems to be a lot of movement between states lately. I'm not really sure if there's if anybody knows why this is going on, but a lot of people are showing up from like Florida or Kentucky and just turning up in Baltimore without really knowing anybody here. And then they don't have Medicaid set up immediately, but once we figure out that they don't have it, we have some staff members whose job it is to help them sign up. So I'd say the vast majority do, and we do what we can to help them get signed up as soon as we find out that they don't have it.
All right, I'm going to have my office call and set up a meeting after this with you to talk about the fact that the Medicaid managed care organizations are supposed to, as part of their contract, be providing case management for difficult populations. And I'd like then to work with you to get an understanding of how robust their case management system is or not.
Sure. Mm-hmm.
Great. Thank you again, Liz, for giving that face to this vulnerable population. We're going to move on then to National Alliance to End Homelessness. We have Nan Roman and Sharon McDonald.
Great. This is Nan Roman. I'll start. We're very happy to be here I'm happy to be here along with Sharon to talk to you about homelessness, and just to thank you for the work of the task force and for caring about this issue. At the Alliance, we use data and research to figure out what works to end homelessness. And then we work largely at the federal level to try to get money and policy behind those things that work better. And we do some technical assistance with communities to implement those things. So our focus, we're not partisan, we're not a membership organization. We just try to figure out what works better to solve the problem. I wanted to start our presentation today just by saying that notwithstanding that people experiencing homelessness often have complex health problems, as we have just heard, behavioral health problems and other needs that require services. But the driver of homelessness and the solution to homelessness really are both housing. The nation is 7 million units short of enough affordable housing to meet the needs of low-income households. People's incomes are often lower if they're exiting jail or prison and can't find employment. If they have health or behavioral health disorders, their incomes are lower. That makes it harder for them to afford housing. People of color's incomes are often lower due to systemic racism and discrimination and historical housing discrimination. And again, that makes it harder for them to access housing. Affordable housing really in the country now is a game of musical chairs, and people with lower incomes and those facing disproportionate discrimination are the losers in getting the housing units. And conversely, people who've exited prison or have health problems or are BIPOC or who have homes are not homeless. Most people who have most people who are Black, most people who are have disabilities are not homeless. It's really housing affordability that's driving things, not their illnesses, which affect their income. Obviously, that problem plays out in much more complexity than I've just laid out, but I did want to just get us started in the context that housing affordability is the major cause of homelessness, and it's the major solution in that people who are housed are not homeless, notwithstanding that they may have other problems. I'm going to turn it over now to Sharon to discuss some other issues.
Great, thanks, Nan, and thanks for everybody for having me. I've been asked to talk a bit about homelessness prevention, and I think the most important thing to realize about homelessness prevention is that the people most acute of risk of homelessness are not accessing, are not being targeted for, and often aren't even eligible for traditional eviction prevention programs. We are by and large missing the most vulnerable people. The majority of people who enter homeless shelters are not leaving their own home. They don't have leases. They are primarily leaving a double-dump situation. They often look like poor candidates for sustaining their housing. In fact, the greatest predictor of becoming homeless is having a previous episode of homelessness. As we've already heard from others, people may have difficulty filling out the paperwork, managing the internet, and they never get to apply. So for these reasons, among others, they are being screened out or not getting assistance. Reliably reaching those at greatest risk of homelessness requires a purposeful strategy. It's not going to happen by accident. One that relies on data to identify who's at greatest risk and outreach to find them and support them in filling out the applications and getting the help that they need. This should involve partnering with homeless service programs and those who most closely interact with those at heightened risk of homelessness. It also really requires building a focus on equity at the very beginning, but all the way throughout, so it's not too late. Black single mothers are at particularly acute risk of being evicted. Half of all families that are sheltered over the course of a year nationally are headed by Black parents, predominantly single moms. People of color are vastly overrepresented in homeless shelter programs across the country. If we're not ensuring resources to prevent homelessness are equitably delivered and have equitable outcomes, we are going to make the disparity in the homeless service system much, much worse. So what are some innovative strategies? What are people doing to really reach people at greatest risk of homelessness? Researchers have been working on assessment tools to identify who, among thousands of program applicants, is at the greatest risk of becoming homeless. But this misses the many individuals and families who never apply for assistance and may never even be eligible for the programs being offered that might require them to have a lease. Some county social service agencies are exploring or implementing universal screening tools. So everybody that comes in is asked to set questions to identify housing instability. Who is at imminent risk of homelessness so they can be directly connected to help. This has been used for years by VA hospitals. It's now being implemented or explored as a tool by emergency rooms, TANF agencies, child welfare agency programs, and programs assisting pregnant low-income mothers who are at disproportionately high risk of homelessness. A really key strategy is using data to inform and refine interventions, placing interventions where they're going to make the biggest impact. Homeless service programs can help policymakers identify the neighborhoods that people resided in and the programs they used before becoming homeless and entering shelter. This can help point to where the intervention should be targeted and who they should serve. People with lived experience of homelessness, such as a youth that we've heard about earlier, can also point to touch points along the way that might have prevented their homelessness. Ongoing research at the California Policy Lab found that about half of people who enter homelessness for the first time in Los Angeles were a consumer of a county-funded agency prior to entering shelter. They are now using that data to develop screening and assessment tools that county agency providers will use, again, to identify and connect their very own customers to assistance to avoid entering shelter. California Policy Lab's research also points to the failure of current efforts to reach the most vulnerable people. They use county data to identify a subset of their caseloads across agencies that are 48 times more likely to enter homelessness than the general consumer. And yet, out of the thousands that made up that group, only 23 received assistance to avoid homelessness. Even in a program, in a county programs that were considered to be well targeted. A subset of innovative prevention programs that's worth paying attention to is narrowly targeted homelessness prevention assistance. These are strategies specifically designed to reach subpopulations at higher risk and implemented by or in partnership with providers who are already assisting them. Some examples is a DV Housing First model, which helps survivors of domestic violence either retain their housing or move immediately into new housing, thereby avoiding shelter stays. California implemented a homelessness prevention pilot for seniors on adult protective services caseloads. And there's been partnerships between rapid rehousing agencies and homeless school liaisons that's helping to assist families of students who are in doubled up situations or residing in motels to either make their doubled up situation more tenable in the short term or to help them secure new housing. So researchers have suggested that the best way to maximize the impact of homelessness prevention assistance is to target it as close to the front door of the shelter system as possible. And this is actually what homeless service systems are now doing nationally. They are providing diversion assistance designed to help individuals and families who have already lost their housing and are seeking shelter or alternative places to stay, to help them find new housing or new short-term or long-term places without ever having to enter shelter. This strategy has been credited as a big part of how DC was able to greatly reduce the number of families they shelter each night. Families are still being assisted to meet their housing needs, but they're being helped from a residence outside of the shelter system. So very quickly, because I see I'm running out of time, nationally regarding reentry, nationally about 5 to 10% of people exiting prison go on to experience a homeless episode. So it's not widespread, it's very discrete. Homelessness after reentry is more likely among those who have been homeless before and those who have received mental health services or were assessed to have substance dependence. There's also wide variation in how people exiting prison will become homeless, with about a quarter of them becoming chronically homeless and maybe homeless for decades. So the variation in how people will experience homelessness points to different kinds of interventions that may be needed. There's a number of strategies being utilized, including family reunification, so individuals can live with their extended family in public or assisted housing legally, landlord negotiation and financial assistance, and rapid rehousing to immediately connect people to permanent housing. In California, some of the money that was saved from the prison system reform was provided to counties to facilitate people's reentry through addressing their housing needs. MDRC is also testing how providing financial assistance can help people reenter communities, and findings suggest that those in the pilot program are largely using the financial assistance they receive to pay for housing and employment supports. Those with higher risk profile, those most likely to become homeless, but also chronically homeless, have been the focus of several interventions, including targeting permanent supportive housing before they've experienced chronic homelessness, and the use of a critical time intervention model, which is an evidence-based case management tool that's been intervention that's been tested for people with mental health disabilities exiting institutional care. One final aspect that appears to hold promise, despite all the challenges of the last year, it appears that the number of families assisted in shelter declined. This may be due in part to the eviction moratorium or people being afraid to come into shelter. But researchers are also interested in whether, with more resources to navigate a very challenging housing market with the economic stimulus payments and child tax credit, that some families are able to resolve their own needs without ever having to turn to shelter. So researchers have estimated that scaling up the shelter system to accommodate every person now living with unsheltered would cost an estimated $3.3 billion to $4.5 billion annually. So we have a responsibility to see if there are better ways to spend that money so that people are assisted to avoid homelessness and to reconnect to housing, rather than to use that scarce resources to create just another bigger shelter. And I'll kick it back to Nan.
And I'll just be very brief because I know we're out of time,
Yeah,
but
just a couple minutes.
would say that we have a unique opportunity at the moment between the emergency rental assistance funds, which you've already discussed, but which the Treasury Department has opined to be used to provide assistance to people who are homeless now. It doesn't have to be just for eviction prevention. There's millions of dollars, billions actually, in the emergency housing voucher program, which is going through the public housing authorities in your jurisdictions. It's supposed to be targeted to homeless households. It's not being very well targeted to homeless households, in part because the services aren't available. And I think that's something that you in the legislature could look to, trying to make sure that the healthcare and other services get attached to those vouchers so that the PHAs will use them for that. They're using them more for prevention, which, as Sharon said, is just not very effective in catching people who would be homeless. So we could probably cut homelessness in half. Maryland, which has adopted, really changed its approach and has a very effective approach, has brought the numbers down substantially over the past few years, could probably cut homelessness in half, maybe even more, by using these emergency housing vouchers. There's also, and the ERA money, there's also funding into the home program, which has probably gone to your Department of Housing and Community Development, that can be used for acquisition and rehab of apartments. A lot of jurisdictions are using it to buy and renovate hotels and motels, which are affordable at the moment because of the recession, and turn that into some temporary shelter that's going to eventually become permanent housing. And there's another $25 billion in vouchers, with $7 billion targeted to homeless people in Build Back Better, should that move forward, not to mention home and community-based services. The point being, there's a lot of money on the table at the moment that jurisdictions could be using to really cut their homeless populations. And I don't know exactly what's happening in Maryland, but I can tell you nationally that it's not happening because it's not being well targeted. And that's a shame. This an opportunity I don't think anybody here is going to see again in their work. Much money on the table for this population.
Thank you, Ms. Roman. And you have echoed what this committee has heard in our prior hearings, concerned that for the federal money, there's no unified source for distribution or a unified plan for priorities and amongst the entire state as it funnels down to the different jurisdictions. I don't see any questions. So we're going to thank you for your presentations today, and we're going to move on to our recommendations. And I think, Ms. Roman, you gave some specifics that we may follow up after this with you as we do our final recommendations to leadership about what we should be doing if we can figure out what we are doing in Maryland as it compares to your recommendations. So we'll probably do a follow-up call with you. Okay?
Absolutely. Just let us know what you need from us.
Okay, thank you. Emily, do you want to flash up the recommendations? We have about 10 minutes to work on them. So committee, what we'd like to do is put the draft recommendations out, let you have time to work on them, talk to the advocates in your area, give us any amendments, any deletions, or any suggestions, and then we will work on a final report and make a decision on whether we need another meeting or whether or not we're close and we can accomplish this without a meeting, but with back and forth discussion and work. With that, the first part is rental assistance and eviction process. I don't know that I don't know, Senator Washington, do we need to read them all out loud? But to say that most of this, Emily, came from the presentation that we got from the state's attorney's office at our first hearing. Is that correct, Emily?
Yes, a lot of this came from the Office of the Attorney General, as well as advocates from Homeless Persons Representation Project, the Eviction Lab, and Public Justice Center that we heard from at the first meeting.
So as we go through the 9, we recognize that a lot of these are coming from other groups that are working on this particular issue at the state's attorney's office and other work groups with ENT. The first one was to improve the timely distribution of rental assistance and other financial assistance. And we talked a little bit about that, but the most important thing we heard were that the local jurisdictions weren't using the most relevant guidelines. And I think Delegate Lehman brought some of that up today about really some confusion about using it prospectively or not. 2 is to design and implement eviction diversion, which we just heard now too, that spending money on diversion really probably gets a lot of bang for the buck. Institute an eviction moratorium for renters with outstanding rental assistance applications. We're going to look and refine this one. We saw an example from another state that's actually doing it that suggested 60 days. And so we might work on this recommendation a little bit more with respect to proposed statutory changes. Number 4, provide access to legal representation, advocates for use of federal and state funds. So we know that the bill passed and it was good, but what we know is it's not funded. And so we think the most important thing is to continue to advocate to leadership that some of the federal and, if we have to, state funds be used for the legal representatives that we set forth in House Bill 18. Number 5, disincentivize serial eviction filings by increasing the filing fees and opposing other requirements. We're going to hope that the Senate can get that done this year, Senator Washington and the many senators that are on. We worked on that in the House. Number 6, improve data collection and outcome tracking related to homelessness. I think what we've seen consistently over the last 2 or 3 years is that if we don't have the right data, we probably can't begin to get the amount of improvement that we need and the decrease, because we can't channel the money and into the priorities without having the right data and outcome tracking. We are frustrated and continue to voice our frustration with the agencies. We know it's hard, but they're not doing outcome tracking with respect to the population after they touch them and give them a benefit. There's no sense of what's happening to them. Serial eviction case.
Did we lose the delegate? Delegate, your mic is.
Sorry, sorry, I know we're rushing against time here. Increase the supply, which we continue to advocate each year, of affordable and workforce housing through increased funding. That's construction, cash assistance or housing vouchers, and policies to incentivize zoning for multifamily units. Had COVID not hit, we were striving towards a unified amount of money in the state, almost like a state bank or backed mortgage system, but we weren't able to focus on that as much this year. And establish a statewide housing rental assistance voucher program in order to provide assistance to additional renters beyond the limited number that are currently being served. And that's, again, looking at a statewide program instead of just each individual county establishing different guidelines. With that, Senator, did you want to do the statement?
Yes, I'll take the next, but also I want to say Ms. Smith is offering a suggestion in the chat, and I think we wholeheartedly agree with you, and we'll consider adding that to our recommendations. Just briefly, and again, I want to say that a lot of these recommendations also are coming not just from this year's briefings, but from the 3 years, frankly, that we've been meeting as a committee. So we can continue to build on them. And so multiple times we've asked state and local detention centers. Again, it's improving, but we still feel that we need to just reduce the impediments to housing for individuals leaving incarceration. There just continues to be a problem. There are barriers at the detention center level. There are barriers, coming directly out of our state facilities, and we just need to reduce it. Secondly, we need to improve the data collection from the state on these issues. And frankly, we are recommending that there be some type of reporting requirement from local level, local institutions, jails, around their homelessness status, as well as from the state, and that the wardens of the individual local facilities and the secretary at the whole should be responsible. Third, I believe we've already passed that one, so I'm going to move on from that. Thank you, Senator Ellis. Fourth, we're going to provide resources for mental health and dual diagnosis on housing facilities. You heard the compelling testimony today on that topic. Provide funding for case management. You've heard that said multiple times. For us to make good on the investments that we're making, we need to track individuals. We need to support them throughout the process and do a better job with them acquiring the funds, but then also afterward, following through on those funds and support. And finally, providing funding that we can use housing individuals that do not meet USDA the HUD requirements. And I know that our state DHCD has done some of that, but we need to do more, specifically on the restrictions based on criminal history, and also the fact that if an individual finds temporary shelter, that then they become uneligible for a number of the supports that they need to continue to maintain housing stability. Delegate, onto the Health Services Cost Review Commission.
Thank you. For the last couple of years, you've seen us try to suggest that under being the only state that has the total cost of care with the global spending on patients, that there's some responsibility in that system, and with the profit of that system and or with the not-for-profit status that they get tax exempt, that they help be part of the solution in the communities in which they serve. And we did see from the HSCRC that there's about 5 hospitals that contribute or know that they're carrying the highest number of people likely to be discharged. I met again with the HSCRC after our hearings, and they're under a lot of pressure with this total cost of care contract with the government, and it's about to be reevaluated. We were very stern with them, Senator Washington and I, that we continue to believe they need to be part of the discussion. So with that, they've agreed to this. Recommend to the Health Services Cost Review Commission to encourage hospitals that see high levels of utilization from homeless individuals to invest in programs and supports to improve the healthcare of this population, either directly or through the support of social determinants of health like food and housing. Evaluate data collected from the HSCRC on hospital utilization by homeless populations. They have agreed to, we think, to use a better coding system so that we have better information from them. So both the local detention centers and the hospitals came to Senator Washington and I chairing this about 2 years ago and said, we have no data. Then they came the next year and said, we have a little bit of data. Then they came this year and said, we're doing a little better. And now we're hoping to continue to do even better. Number 3, recommend the Health Services Cost Review Commission to adopt the revenue for reform policy, which will further align incentives to encourage hospitals to invest their retained revenue in community health initiatives, such as housing and other social determinants of health related to housing instability. And Senator Washington and I will be continuing to work with the HSCRC before we start meeting again as a committee about the new grants that they're putting out and the focus of those grants with respect to housing. And number 4, schedule presentations for the HSCRC Commission on the progress of data collection and programs to support the homeless populations. So I do think we've entered a very functional and working relationship now with our committee and the hospital community with respect to the intersection of healthcare and homelessness.
And finally, of course, when we say, the chairs, we also engage members. So any members that want to be a part of these discussions are welcome. And also these recommendations include a lot of the things that you've sent to us as well. We see ourselves as facilitators and collators of the ideas of the committee. And then finally, the last 2 are sort of a miscellaneous category, and it is a recommendation by this work group, this joint committee last year, that we work on the adaptive reuse of vacant and commercial spaces to see the ways in which they can do essentially the things that we are talked about today and have been talking about for at least the last 20 months. And so we would like to reintroduce the House Bill 877, just that topic. We would like to extend the time essentially on the bill for a couple of years, because we understand this is the last year of a term, but again, this is an issue that we can't continue to delay. But in the interim, we want to strongly recommend that the standing committees have hearings on this topic of adaptive reuse of vacant commercial properties. Those of us who are on this committee know about this issue, but it's important that the standing committees that would be setting the laws and the policies and the budget priorities understand how important this issue is as well. So that's a 2-part recommendation. And then finally, just case management best practices. We continue to recommend that we must implement best practices when it comes to case management and doing what we know will help persons experiencing homelessness or who are at risk of homelessness. That brings us right to 3 o'clock. So I know if there are burning desires or individuals, we have space, time, we could have another meeting, but the special session sort of is getting away in the original, is close to the special session, but we can get feedback now for 5 minutes and then continue on via.
A lot of people are leaving spending affordability, which I'm.
Oh, that's right. Okay, then we
and
all
Senator
need to.
Elworth and a couple people are exiting because we have to get over to spending affordability, which is.
Let's get over there.
But why don't we have, if anyone has a robust, certainly concern right now, but why don't we give it a week? Do you think a week is enough time? 10 days?
Yeah, that's fine. Yeah, I mean, we have senators Sidnor, McKay are still on. With your permission, are we able to sort of take a break here? Yes, very good. And we'll continue the discussion. But give you a week or so, we can go back and forth. And certainly if anyone wants to meet in the interim, we're happy to do that.
Right, and go back to your local advocates, your local continuums of care, and anyone else with these recommendations. And Senator Benson, I will get with you next week for us to work on our local issue together with respect to Prince George's County.
Will we get a copy of what was just presented? The recommendations?
Yes.
Yes. Get that to take a look at it.
Yes, thank you. You will. All right, well.
And in the narrative of the report, we'll be putting in the cost of incarceration, what it is at the state and local detention levels, and the cost of hospitalization, and try, as the advocates have told us, to spend money now to save money later.
Mm-hmm.
Again, Senator Sidnor, any other, want to give people an opportunity who are here to say any final words? Okay, great. All righty. Okay, well then this meeting of the Joint Committee on Ending Homelessness is adjourned. Thank you all for listening, and be safe.
It's been a privilege to work with everyone. Thank you.
Thanks.